Hi, my name is Clayton Petro, and I'm here to report the one-year outcomes of the Prove It randomized controlled trial. The Prove It trial was a randomized trial comparing laparoscopic and robotic IPOM in 75 patients. We found no difference in our initial publication in the early postoperative pain, including our primary outcome, which was pain on the first postoperative day. The NIH PROMIS scale is a scale that measures pain intensity, and so at 1 year, there was no difference in pain intensity between the laparoscopic and robotic arms. Hercules is an abdominal wall specific quality of life assessment tool. There was a statistical difference favoring the robot, 12 points higher in quality of life at 1 year, again favoring the robot, although this does fall under the minimal clinically important difference of that tool, which is 15. In terms of recurrence, the majority of our follow-up was done by the hernia recurrence inventory, which is a question that asks patients if they feel or see a bulge. That trended towards favoring the laparoscopic approach. That was supplemented with a clinical exam and CT scan less than 50% of the time because of the COVID pandemic, which is when most of the follow-up fell within. The composite outcome includes the hernia recurrence inventory supplemented with the clinical exam when available. And so by all measurements, the recurrence profile favored the laparoscopic approach. Reoperations were similar in the two groups. So to summarize, there at 1 year between laparoscopic and robotic IPOM, there was no difference in pain intensity, potential benefit in quality of life favoring the robotic approach, and potential benefit in terms of recurrence favoring the laparoscopic group. The mechanism of these differences, whether it was related to permanent versus absorbable fixation or technique, needs to be the subject of future trials. And so future well-powered studies should investigate these differences. Thank you.